And it is also nice and unusual, as Dr. Naik mentioned, that we are sort of holding an event like this. And maybe it will be useful for everyone, irrespective of whether one is interested in another person's topic or not. But I think the approach to writing a good research paper, as Professor Misra mentioned, that is what we are trying to focus on. We are trying to improve the quality of the journal. And without wasting much time, as I had sort of indicated to all the authors, so we have 15 minutes per paper, whoever one single person has to present it, and to be followed by maybe another 15 minutes of discussion. So we sort of keep moving like that, and with a 1 hour break at 1 o'clock. So total today we have 9 papers. So with this, may I, with everybody's permission, may I sort of request Shivlal Meher, Professor Shivlal Meher, for the first presentation, the paper titled "Influx of Migrants During COVID-19 and Employment Scenario in Odisha." Please, Professor Meher.
This paper will present by Dr. Josnami Nanda. I request now Josnami Nanda to present the paper.
Okay, no problem. Yeah. You have a PPT or something? Professor Meher?
It seems Professor Meher will not be presenting. It seems somebody else will be presenting. Am I right? Josnami Nanda or some name was mentioned?
Yeah. But I think Professor Meher is present, or Dr. Josnami Nanda, whoever.
Yeah. Say present Kori over there.
Acha. Is she present today? I don't know. If we are Josnami Nanda, yes. I think Josnami Nanda ji, please unmute yourself. Professor Meher and Professor Nanda, I request you to please start the presentation and unmute please.
It seems Josnami Nanda has left the meeting. That is what it said just now.
Oh, okay. So I think in that case, let's move on to the next paper, because I don't think we should waste time on this. We'll come back. So maybe
yes.
Is Mr. Madan Meher
now it says Josnami Nanda has joined again. She has again joined. It seems. Shivlal Meher joined also. Both of them are there.
Shivlal Babu or Josnami Nanda, please don't take much time and start the presentation. I think they are. Josnami Nanda has not unmuted.
That's why she is unmuted, it's clear.
Okay. Dr. Nanda, Josnami Nanda, are you hearing us? No, because I see it is not yet unmuted actually.
No, she has unmuted, it seems. Josnami Nanda has unmuted. Madam, apno tike kuhantu kichi, so that we can hear you. She has unmuted. She is unmuted.
Yeah, I think she is having some technical issues. Maybe we can.
There is some technical issue. Perhaps is that.
The next author.
we move to either Sibilam Meherji, if you want to say something, or we move to the next paper and you can come back later.
You can come back later because she has some problem, I think. She has unmuted, but hello.
Yes.
I think she is not audible.
Oh, okay.
Volume.
So, Professor Meher, what shall we come after the first paper?
Yeah. You can move next. After the next paper.
Okay. Okay. After this second paper, you could probably come back. Yes. So may I request Mr. Madan Meher, please?
Sir, namaskar, sir.
So your paper is on COVID-19 in India, a critical assessment on pandemic modeling and forecasting gross domestic product using ARIMA. Madan
Yes.
Meher, Nikita Pradhan,
Yes.
and Murad Bormaz. You have 15 minutes.
Okay, sir. So let me start. Sir, namaskar. Good morning, after all, everyone. Esteemed chair of the session, honorable professors, and my fellow colleagues or the participants. I, Madan Meher, MPhil Research Scholar, second author Nikita Pradhan, MPhil Research Scholar, and my guide, Dr. Muralidhar Majhi, Assistant Professor in Economics of the Gangadhar Meher University, Sambalpur, have prepared a paper on COVID-19, a critical assessment on pandemic modeling and the forecasting GDP using ARIMA. So, shall I switch over to the presentation now, sir?
Yes. Yes, please.
Okay, sir. Thank you. Okay, sir. Thank you. Sir, is it visible, sir?
Yes, it is visible. Yes.
Okay, sir. Thank you, sir. So it's an honor to present this paper in your esteemed journal, sir. I just want to do the abstract first. In the first segment of this article, a modified, suspected, exposed, infected, and recovered, that is known as SEIR model, pandemic model has been done to identify the chain of the virus. In the second segment of this present study, GDP, which is the current price, the forecasting of GDP at current price has been done using the ARIMA methods and the expert modeling methods in the SPSS IBM. And the data for the GDP has been taken from of the IMF Outlook database from the year 2001 to 2021. It has been clearly observed from the present research is that the trends in GDP before the pandemic, before the pandemic shows an upward linear path which is very undisturbing in nature and which is considered to be normal. But after the great economic shock of 2020, the trends of GDP follows very fluctuating and unpredictable paths, sir. So it is my first slide, which is going to do the abstract only. And in the second article, we have introduced the historical perspective of the novel coronavirus pandemic, which is an ongoing pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome coronavirus 2 SARS COVID-2. This outbreak was firstly identified in Wuhan, Hubei, China in December 2019 and was recognized as a pandemic by the WHO, which is World Health Organization, on 11th of March 2020. So this pandemic has also alarmed India after the first case was identified and confirmed on January 30, 2020 in the state of Kerala. Till June 3, 2020, total 2,19,582 confirmed, 1,11,000 and 2,285 recoveries, and 6,115 deaths are reported in India, according to the Ministry of Health and Family Welfare data of 2020. As a non-pharmaceutical infection prevention and control intervention, the government of India has adopted the social distancing method. This strategy aims to avoid or restrict the large-scale mass movement, which may accelerate the pace of the contagious epidemic disease. A 14 hours voluntary public curfew, which is also known as Janta curfew, was put in place on March 22, 2020, and subsequently a nationwide lockdown was implemented on March 24, 2020 to contain the spread of this coronavirus disease. The lockdown was since extended for the fifth time, and after for till June 30, 2020, and is affecting 1.3 billion population all over the world. And first case, the Odisha, identified on 16th of March 2020, according to the Ministry of Health and Family Welfare data of Odisha 2020. So, sir, it is the only introduction part. Then now I move on to the next slide, which is showing the effects on migrant workers. According to the medical and health experts, social distancing is one of the effective prevention and control methods in the absence of vaccines. So, however, lockdown strategy to impose social distancing has immediately and adversely affected the migrant workers, particularly to the marginalized section of the society who depends on their daily wage for living. Without any source of earning and no means of transportation to return to their respective native places, these workers are now stranded in different parts of the country. So documents submitted to the Supreme Court of India regarding the numbers of migrant workers, which indicate that approximately 10.55 million migrant workers are living in 22,567 shelters set up at various parts of the India. So staying away from their family, these migrant workers are insecure about their earnings and emotionally disturbed. A recent anecdote was mass gathering on April 14, 2020 in the railway station near Surat, Mumbai and Surat, reveals their strong desire to return to their place. So it is effects on migrant workers. In the next slide, I will do the impacts on human behavior. So the direct economic effects of illness resulting from COVID-19 are increase in healthcare expenditure of patients and funders like insurers and governments, heavy work burden on health workers like doctors and nurse. Indirect effects are decrease in the supply of labor due to death and increase in absenteeism from work sector by sick laborers. So prophylactic absenteeism is one of the best voluntary strategy for modifying the risk in response to a pandemic. School closure may be categorized as a non-voluntary risk modifying behavior, as gathering of children and teachers in school can accelerate the spread of virus. FAN in 2003, I have literature review the FAN opines that a pandemic can drastically reduce business investment because of high uncertainty and risk, which leads to excess capacity. Similarly, confidence level of consumers will also decline due to fear and uncertainty, which leads to a decrease in consumer spending, as people opt to reduce the probability of infections. So the decline in consumer spending affects the service like which involves to face-to-face contact, face-to-face contact, transportation, and retail servicing, etc. So this is the my impacts on human behavior slide. Then we'll move to the next slide, which is the modified SEIR pandemic modeling in India without migrants. So, sir, here we have only emphasized on how the SEIR model, modified SEIR model has worked. Here we take insuspectable in P compartment, suspectable in S compartment, exposed in E compartment, infected in I compartment, quarantined in Q compartment, and recovered and deceased in R and D compartment. So here the rate in which the people are going to vulnerable or susceptible to the disease is the alpha rate, and the being exposed is beta rate. From exposed compartment to infected compartment is gamma rate, and from infected to the quarantine is del rate, and quarantine to recover is lambda t, and quarantine to death is kt. So by using differential equations methods and differential integral method, we have analysis this part only to show the chain of this virus. So here in the next slide, SEIQRD, the summation is equal to n. So n is here the total number of population, beta is the rate of exposure, alpha is the rate of being susceptible, gamma is being infected after exposure, and delta is detection rate leading to quarantine, kt is our mortality rate, and lambda is recovery rate. So it is the SEIR pandemic modeling. Then we have to move to the next part, which is forecasting GDP in India and economic modeling. So GDP, as we all know, is the aggregate monetary measure of the market value of all the final goods and services produced within the domestic territory of a country within an accounting year. So GDP time series data generally consists of observation created successively over time. As the data in time series are ordered with respect to time, the observation which are successive in nature may be dependent. So this observed time series is considered as a time series realization of an underlying process. The data either may be short term or long term, or can be increasing or decreasing or even constant. So next move to the ARIMA, which is auto-regressive integrated moving average model. As we all know the theoretical aspect of this ARIMA, we have applied this ARIMA modeling in the expert SPSS modeler. So from the theoretical aspect, the ARIMA models were firstly made famous by George Box and William Jenkins. They consider it as an iterative process which passes through the four stages of identification, estimation, diagnostic checking, and forecasting of time series, which is also known as Box Jenkins methodology. So George E.P. Box and William Jenkins opined that ARIMA models are a class of linear models which is capable of determining both stationary and non-stationary of time series. They do not require independent variables in their formulation, rather utilize the available information in the time series to forecast. So ARIMA model thus depend immensely on the autocorrelation of the data. So what is autoregressive process? Here every past value possesses cumulative effect on current level dependent variable, and it will make a long run memory model. So what is a moving average model? It is purely a time series model which involves the uses of errors in the past as explanatory variables. So autoregressive moving average model, which is ARIMA, and ARIMA present ARIMA model, which is 101. 1 is P number of times of autoregressive model, 0 is number of time of differencing, and 1 is number of time of moving average process. Here in this article, we have presented the GDP forecasting model using ARIMA model PDQ 101 suit. Then in the next part, it is just autoregressive integrated moving average process, which is ARIMA. ARIMA PDQ, which is non-seasonal in nature. Here P represents the total number of autoregressive terms, D represents the total number of differences, and Q represents the total number of moving average terms. So ARIMA 000 is a white noise. White noise means there is a constant mean and variance is very limited. We can say ARIMA 010 can also be called as a random walk model, as there is no involvement of AR and MA part, and there existence of only one time of differencing. So in the next slide, I will represent the Box Jenkins frameworks and the four stages of this framework. First one is the identification of model. Second one is the estimation, which type of ARIMA model we are using, whether it is 101, whether it is 001, whether it is 100. Then the third part is the diagnostic checking. Then if the model is suitable, then we can go to forecasting part. If model is not suitable, then we go to first part, that is identification. So it is basically Box Jenkins framework. Then the data set that we have collected for the model forecasting from the year 2001 to 2021. Here 2019, 2020 and 2021 is purely estimated by IMF staff, and this data has been collected from the IMF Outlook database, and the amount is in $billion. So from 2001 and 2021, we can see the GDP at current level, current prices. Then move to the next slide. Then analysis of the data. The present study has applied the ARIMA forecasting model to GDP at current price, purchasing power parity, and international dollars in billions. In order to that, we have to make sure that the data should be stationary in nature. So firstly, before moving to the ARIMA part or ARIMA part, forecasting part, we have to know that the data should be stationary in nature. The stationarity of the data can be estimated by examining into the time series, sequence chart, and correlogram, both ACF and PACF. Then ACF and PACF plots we will discuss later. Then identification of stationarity of the data, a basic analysis. This figure has been purely done on the through SPSS IBN, and here the time series plot of GDP at current price and purchasing power parity and international dollars in billions has been done from 2001 to 2001. The time series plot has been done. Then in the second part, sequence chart plot, which is also used for measuring the stationarity of the data, we can here see the sequence chart from 2001 to 2021. In above chart, figure 1 and figure 2, we can clearly observe that the data we can clearly estimate that the time series data here is stationary in nature, purely stationary in nature, as there is an absence of exponential or logarithmic trend, and mean and variance seems to be constant. Therefore, the data is stationary in nature, and hence we don't need to apply any kind of log differentiation to it. So The data, the figure itself suggests that there is an absence of exponential or logarithmic trend, and it is a very stationary in nature. Then figure 3, that is the correlogram for GDP at current price using autocorrelation function, that is ACF. It is also done through SPSS IBM. And second one is fourth figure is correlogram for GDP at current price using partial autocorrelation function. It is also done through SPSS IBM. In both this ACF and PACF, which is autocorrelation function and partial autocorrelation function, we can observe that the limit and upper limit and lower limit is not crossing the limit of 0.5. That means our data seems to be stationary in nature. If we go through the SPSS IBM statistics, their tutorial, they can suggest that if the ACF has crossed 0.5, then it is non-stationary in nature. So our upper limit and lower limit data has not crossed the limit of 0.5, both in positive term and in negative term. So the above figure 3 and 4 represents the correlogram with ACF and PACF respectively. These function charts clearly indicate the stationarity of the data, as no seasonality or trends is present there. A stationary time series means whose properties do not rely on the time at which the given series is observed. So here also we don't need to transform the model by taking the differences of the natural logarithm. Then we move to the ARIMA model through Miller's algorithm. There is a tool in the SPSS which predict the ARIMA model, and through Miller's algorithm, which is 101 process. So here we can see that the parameter estimation, our non-seasonal lags estimate standard error T and approx significant value. It is only predicted to know the approx significant value. If the approx significant value is less than 0.5, which you can say it is 0.
Sorry, Mr. You have just about 2 minutes. Yeah.
Okay, sir. Sorry, here approx significant value is less than 0.5. So the model is fixer than covariance matrix. With covariance matrix here, Durbin-Watson test is not applied. The covariance matrix is less than 1. So here the absence of autocorrelation. Then residual diagnostics, we have done AIC and BIC. So the difference between AIC and BIC is near to 1, near to 2. So there is a goodness of fit here. Then with the syntax used in SPSS for ARIMA 101, this is the syntax I have used. We have used sample forecast through time series expert modeler, which is done here. So the actual GDP and fitted GDP and errors. So here the errors are from 2001 to 2021's errors are less than 5%. So there is a less error present there, and the model is fitted for the forecasting. Then we have predicted GDP from 2022 to 2026 from fourth quarter each year. So there are 1, 2, 3, 4 quarter for every year we have predicted the GDP. Then we have plot a graph on fit and observed value, and there is no much difference in fit and observed value, so the model is fit 1. Then we have come to the model summary, where R square is 0.539, stationary R square is, and R square is 0.995, which is a good one. Aljong box statistic is greater than 10, which suggests that 0.05, which suggests that the residuals are independent of each other, and MAP, which is mean absolute percentage error, is below 10, which suggests that there is a less error present in this forecasting. Then the great economic shock of 2020, how it impacts the trends of actual GDP before Corona and predicted GDP after Corona. So we can see that mean trends of actual GDP before Corona from 2000 to 2025 is very smooth and upward trending in nature. But after this diagram, we can say that from 2022 to 2026, this diagram suggests that after great economic shock of 2020, the GDP has been very fluctuating in nature, and therefore it is unpredictable to implement any kind of fiscal and monetary policy in India. So it will adversely affect the government and RBI in decision in formulating a proper economic roadmap for the country. So the summary and conclusion is that we have taken the model of the Indian GDP from 2001 to 2021 from the IMF Outlook database, and using ARIMA 101 model and SPSS expert modeler methods, we have predicted the GDP, and the error value lies below 5%, and it is well fitted, and we have predicted that the GDP is going to very fluctuate in future, and we have to maintain the microeconomic as well as the macroeconomic stability and protect the economy from severe disturbances. Here are the suggestions for the further research: analyzing the GDP in India using various models of forecasting and examining the individual components of the GDP. And here are our references, sir. I think, sir, the time is over. So,
Okay, sir.
B2 slide is not showing. B2 slide is not showing. Slide you show it. B2. Madam Meher, please. Slide is not showing.
sir, which slide, sir?
The slide is remaining same. Please change it if possible.
Sir, I have changed the slide, sir. Yes, sir, I am doing it.
Professor Nayak.
Yes. I just have a very brief one or two comments. Well, let me begin by saying that I'm very impressed with the level of econometric work that you've done and the familiarity that you have with this class of econometric model building. So that really gives me a lot of hope and sort of satisfaction. But at the same time, I must say that I'm not really an expert in these econometric kind of techniques. Perhaps Professor Mishra will be able to say something on this. I'm pretty sure he'll be more up to date on the formal econometric modeling part. But the observation I have on the paper is the following. In any paper writing, no matter how sort of complex and no matter how advanced the technique that you are using, at the end of the day, the paper should be able to say something very clearly in simple words, even if you're using the most complex modeling. My observation and suggestion to you is the following. You can use the most advanced techniques. Please do so. Please do so. But at least in the introduction and in the conclusion, you should make a very clear statement of what your objective is and what the existing knowledge base is on a particular issue, and finally, what your contribution is. So if you are saying that, what I could understand is that you are predicting that there'll be a lot of fluctuation from right now 2020 2021 till 2026. That seems to me to be more or less right. But if this conclusion can be given with a greater degree of sort of ease of understanding to the reader, I leave it to your best discretion to do. My second and last point is the following. Presumably at the time that you wrote your paper, that was at a time when the GDP figures were still to come out by the government of India. And now we know the GDP figures and how the figures have gone. Now we know that in the first quarter, there was a drop in GDP to the extent of 23.9%. We know that. Now, at the point you wrote the paper, presumably we did not know it. So my question to you is the following. Could your model have predicted a drop in the first quarter, first 3 months, of anything as much as about 23.9 or say 24% or thereabouts? Does your model predict it or it does not predict it? So this is my direct question to you.
Sir,
You can I would suggest you listen to the comments, criticisms, etc., and you try to give your observations at the very end. So Professor Uday Mishra will have something to say, Professor Keshav Das may say something, Professor Amrendra Das may say something, and then you react to it. So
sir, I just to answer
your question. Please wait. You will answer my question, you'll get the time. I think I would suggest that Professor Uday Mishra should say something, then Professor Keshav Das, Professor. That's how we'll be able to manage the time also. If Professor Das, you think this is okay, we can go that.
Absolutely. Yeah. Professor
Namaste,
Mishra.
sir. Right. Namaste, sir.
Sir, no.
Well, let me make my observation. I think I connect with the comment that Professor Naik raised about the paper, and it is generally for every paper that I read, because in the very beginning of the paper, I would like some kind of textual revision, which is essentially to highlight and make the clear statement as to what this paper is intended to give to us, rather than writing on COVID. Yes, it is COVID, but then you have a different focus, and that perhaps you can reorient your language to tell us explicitly as to what does it offer. When it comes to technicality of the paper in such a forum, I don't want to go to nitty-gritty of it. There is limitations at every place possible. You can use, there are advances every day in these techniques and methods. But you have stated that in your limitations also. It is, I'm not saying that you have not done it. But having said that, my observations are very definite, operational, which you can do. First thing is that whenever you apply a model with existing data, as Professor Naik rightly told, that if the time has elapsed and you have got figures of GDP, you perhaps have to contrast it with the fact that what exactly does your model offer and what has come out. That is one. And one very significant part that will perhaps enrich your paper better and be acceptable is that you are doing GDP forecasting, and during this period of last 3 to 4 months, there has been umpteen set of work which exists, whether it is by IMF, whether it is by ILO, whether it is by World Bank, regarding this predicted GDP situation of India and other countries as well. So a bit of kind of contrasting of your results. It is not necessary to say that it should agree, but you must present that our figures and those figures differ, and what are the kind, if they differ, and what are the kind of reasons that you have, because there is sufficient reason, because predictions are predictions, they are supposed to differ. So obviously you have to make a connection with the existing literature. That is one point which you should keep in mind. The second thing is that, in fact, because the pandemic is in continuation and the parameters that you have used as your susceptible, infected and all that with the data, that has also perhaps changed a bit. And because nothing is done by you on your hand or anything, it is computer, I would suggest that you use the most updated one now, because the pandemic has evolved to be with a little bit of a variation. So if your results really change or become more compatible with what people are talking today, would be because of the fact that you will use the most recently evolved data. I'm not asking for much more, because everything will be done by the model. I'm not criticizing the model either. So this is my second observation. And the third observation that is very important is to say that you are doing a GDP prediction undoubtedly, but please mention not merely this aggregate scenario of what the GDP will be or what it entails if the pandemic continues, the curve flattens or whatever it is. You should be able to say very specifically as to whether this particular finding that you have, how will it be in terms of its composition? Because at some point in the paper and other papers in the volume are talking about migrant workers, are talking about informal sector. So obviously there will be some sectors where the GDP won't be affected, and there will be a substantial sector where it will be affected. So some clue to that if you give, you could be even able to justify that actually what are the kind of remedial policies or measures can be adopted so that the decline or the crisis in GDP crash may not happen if they emphasize. These are my observations. Absolutely good paper. I have no doubt about it. You have made an effort. You have put in, proper data into it, and you have done within your limitation a great job. But please do address these things so that the paper becomes better. Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir.
Maybe Dr. Das, Amarendra Das, you want to say something?
No, I was just thinking whether you have done sectoral analysis also, the forecast for different sectors, or you have looked at only the GDP?
Sorry, sir, I can't hear.
Yeah, you
Whether
can just...
you've done sectoral analysis is the question.
Sir, sectoral analysis are you talking? Sir, I can't hear
Okay,
you.
now you can respond.
Mr. Meher, please listen to what Dr. Das is saying.
No, I was asking whether you have also done the forecast for the different sectors like
No, sir.
agriculture
Only,
and the
No, sir.
only
no,
GDP.
sir. Only GDP, sir. Only GDP, sir.
Okay.
Only GDP. Yeah.
Sir, namaskar, sir. I am the guide, sir. I am the guide from JM University.
My guide sir is present there, sir.
Okay,
Sir,
nice. Yeah.
I think now you can respond if he needs to respond.
Yeah, maybe just 1 or 2 minutes time if you wish to respond, Mr. Meher, or if the guide wants to keep in whichever way.
Yeah.
Sir, sectoral analysis has not been done. Actually, we have taken overall, and as per your suggestion, sir, definitely we will revise our article as per the sector and quarter also, sir.
Yes.
But Mr. and Sir Pulinak sir suggested, definitely we will do that, sir, if time will be given, sir.
Yeah. No, you'll be given 10 days or so, 10 days or up to 2 weeks maximum, I suppose. Then they would
Thank you, sir. We will do that, sir. We will definitely consider your suggestion and we will try to go for that, sir. Thank you for your suggestion, sir.
If you do it within 10 days, that will strictly meet Amarendra Babu's sort of suggestion. And he is the secretary. He has to.
Yeah.
Very good. Very good.
Very good. Thank you very much.
Excellent.
So, sir, Professor Naik and Professor Misra, with this, shall we move to the next paper?
Yes, please.
Of course,
please.
of course. Please.
You have to keep the tempo right, and so you have to get 4 papers before the pre-lunch session. Yes, of course. Yes.
So thank you, Mr. Meher, for the presentation, and hope you will respond to the comment. We'll write to you separately. Thank you so much. Thank you, Professor Maji, for joining.
Thank you, sir. Thank you, sir.
So we move on to the next paper by Anirudh Barik and Balakrishna Padi. The paper is Pandemic Beyond Lockdown in India. About 15 minutes, anyone can start, and all others kindly keep mute. Yeah.
Good morning, sir.
Yeah.
Is it audible, sir?
Yes. Yes.
Okay. Okay. Very good morning, sir, and to you all. First of all, I like to thank Odisha Economic Association for shortlisting our paper, as well as Pulin sir, Mishra sir, Keshav sir, and Amar bhai for the kind regards. This study actually has been jointly written by me and Anirudh Barik. So I'm going to share my slides. So the title of our study is Pandemic Beyond Lockdown in India. So this study is mostly a empirical analysis based on from the period when the pandemic has started till 31st of May. Our study is actually restricted to that based on the time we have submitted our paper. So when you discuss about earlier study, also discuss about this humanitarian pandemic, that is COVID-19, brought a significant impact upon the economy, which leads to disruption in the demand and supply sides of the economy, as well as hurts lives as well as livelihoods. And as a result, the recent study of ARIMA, that is basically the great lockdown, also shows that this pandemic can be worse than this 1920 Great Depression as well as 2018 global financial crisis, which may lead to contract the total overall economic growth from around say -3% in 2020 and may to recover in 2021. While the growth rate of India will decline, but will not go into the negative zone. So when you discuss about this pandemic, after this pandemic has started since 30th January 2020, the government of India has taken several measures after in March 11 when the WHO declares this COVID-19 as a global pandemic. So in the phase-wise manner, the country started putting the lockdown. That is the first phase, second phase, third phase, and fourth phase. So our analysis restrict up to 4 phases. And accordingly, different measures has been taken to restrict the spread of this crisis, which include closing of schools, workplace, cancelling of public events, public transport services, banning of the mobility and transportation of domestic and international, mobility of the people, and bans on public gathering, restriction of the any kind of festival observations, as well as other interventions like various physical as well as monetary stimulus package also been announced during this period. And accordingly, the government of India in March, they have declared the different kind of packages, let's say Pradhan Mantri Garib Kalyan Yojana, Atmanirbhar Bharat, and others, which also later on come with some kind of criticism due to the kind of schemes they have implemented, because it only able to benefit a very small chunk of population, given our economy is a huge informal economy, and this also leads to large number of people, migrant workers, to return back to their hometown. So it created also a lot of problem in the economic activity. So given this backdrop, the aim of this study basically to evaluate the scorecard of COVID-19 pandemic in India and its major states during last 68 days of basically the 4 phases of national economic lockdown. And the second, to evaluate the changing structure of health status under this pandemic. Because here we basically have to measure in a very simplistic format how the basically health status of the people has been changed, or how this pandemic has leads to change in the prevalence rate or fatality rate in the 4 phases of pandemic of this lockdown in India. And the data set you have taken from WHO, Ministry of Health and Family Welfare, as well as COVID-19.org India. And regarding methodology, in this study, you have followed 6 methodology to calculate the prevalence rate, that is basically total number of confirmed COVID cases to total population per million. Second is case fatality rate, that is the COVID death to total confirmed. Mortality rate, that is basically total confirmed death to total population. Then you have calculated the doubling rate, like across states as well as all India level, how many days basically takes the cases to double. So basically the total number of COVID-19 confirmed cases. Next is about recovered rate, and lastly about sample test multiple, which basically talks about total number of sample test to total confirmed cases in India. So if you look at the aggregate level, as per the WHO estimates, in 31st May 2020, this global pandemic has almost reached around 213 countries across the world, and it's also affected almost 5.95 million are there in the confirmed cases, and 0.36 are the death cases. While in India, the total number of confirmed cases was 0.18 million in up to May 31st, 2020. And if you look at the different phases of the lockdown period, how the total number of confirmed cases per million has increased. So let's say in the first, you can say the first phase of lockdown, the number of confirmed cases has increased from 0.5 per million to till 4 phases around 131.3 per million in the fourth lockdown period. And on an average, the case fatality rate second in India was around 1.7 at the beginning of the first lockdown and 2.9 in the fourth lockdown. Lastly, when I look the global fatality rate, that is increased from 2.4% in January to 6.2 in a global level, while in India it is 1.7 and 3.3. And while discuss about this global lockdown and this pandemic, this Oxford University, they have developed this called as a stringency index. This what kind of stringency measures of around 17 different kind of policy measures that the country has taken, and accordingly they developed a stringency index. Is 100 means it is most the country is most stringent towards various measures to curtail the pandemic. And if you look, the stringent measures has been increased till 27 March 2020, and after that the stringent measures has been declining slightly due to a small phase of relaxation in some few parts of the country. Secondly, if you look the total number of COVID cases, confirmed cases in different phases of lockdown, both in India and if you compare it to the global level. So till, if you look the aggregate level till 24 March 2020, the total, actually the number of cases almost a flat kind of curve we can find. And till that, there is a significant jump in the total number of COVID cases, and it is increasing like in a very spike manner. And if you come to the recent cases, the spike is much more, where we can find almost every day we are getting almost 1 lakh positive cases. Accordingly, the recovery rate is also India is very good, which is around 78% in the present scenario. Next, if you look the across Indian states, how the prevalence rate has been changed in the different phases of the lockdown period. So let's actually start from the beginning of the lockdown, when the in India, when due to this COVID, the lockdown has started. So like in 25th March 2020, during this lockdown, you can find the prevalence rate, that is basically per million, how many people has been affected by this COVID-19. So in the first phase, you can find the prevalence rate is very small in most of the part of the country. And in only Kerala, they say the percentage is around 3%. This not percent, this is the prevalence. Next, if you go to the second phase, that is in April 15, we can find the number of prevalence rate per million is increasing significantly. Like in most of the states, let's say in Punjab, Haryana, Gujarat, and you come to the fourth phase of this lockdown, you can find there is a significant increase in the overall prevalence rate. Like in Odisha, you can find there are 44 cases per million. It has increased significantly. Next, if you look the case fatality rate, how it has been changed. So if you look the case fatality rate, in the beginning of the lockdown, the case fatality rate is more little or minimal. It is around 2%, 2%, and around 2 in Maharashtra, as well as Gujarat, and few parts of the Bihar, because there are only few cases, like out of 4 cases, only 1 people has died. So due to the reason, you can find red in color. So in the next phase, if you look, and if you go to the fourth phase, you can find across states the number of fatality rate, the case fatality is also increasing. But one of the major things here you can able to say, because the lockdown has been implemented, or it has gone in a phase-wise manner in different states as well as all India level, to basically make reserve capacity or make the capability. Because once the people will come, and if the movement of the people will occur, when the virus spread will occur, how you can able to make a different kind of medical or hospital kind of facilities, and how you can able to make avail all these facilities to all. And due to this reason, if you can say that if the lockdown has not been there, the cases of this fatality rate and the prevalence rate may be higher. So if you go to the next, here you calculate basically sample test multiple. That is basically calculated number of tests of the total COVID, total number of positive cases. So there are the testing strategy has done to achieve 3 goals. One is to surpassing the surgence of the local outbreak, identifying the people who has developed some sort of immunity and safe to return work. Third is to gaining intelligence on the evolution of the pandemic. And if you look across states, the sample test multiple is much more higher in Mizoram, Meghalaya, Goa, and what is much more lesser in Maharashtra, Telangana, and Gujarat. Next, actually, we have shown a relationship between 2 things. One is called a sample test per million population, and percentage of COVID-19 positive cases from the sample tested. And here the red line marks basically shows the mean of the total India. So here you can find the states where the sample test per million population is much more less, but whereas the percentage of COVID positive over the sample tested is much more higher. So the combination of this thing you can find it differ across different states of India. So in the lowest, you can find that most of the sample test for multiple as well as percentage of COVID positive sample tested is higher, like it's in Bihar, or it comes in the 3rd quadrant, and the 1st quadrant, Nagaland, Meghalaya, Sikkim, Himachal Pradesh, Odisha, most of the states has been followed. Next, when you do some kind of regression analysis, What you can find that, yes.
Sorry, maybe another just 2 more minutes.
Yes, sir. Just this is my last slide, sir.
Okay.
So the sample test multiple was basically taken as an independent variable, and the logarithmic value of the sample positive as a dependent variable. It shows that it explains around 86% of the total variation in it. So next, when you calculate basically the doubling rates, how many times basically it takes for the total number of cases to double, and like you can find in the first page, it takes only around 4.5 days, and the doubling rate has been reduced to 14 days, around 14 days in the fourth lockdown. And across states, you can find in Chandigarh, Gujarat, the doubling rate has been reduced, and in Punjab, it is much more lower. So you can find that in India, the very slow started of the flattening curve like Punjab and Andhra Pradesh. And this study also finds the need of emphasis of rapid identification, isolation, quick test, and treat to combat or restrict this of the spread of this pandemic, as well as you can find that various states like Kerala, Uttar Pradesh, Maharashtra, Odisha, they have taken different kind of policies for the migrant workers. Also, they take different kind of initiative or health measures to combat in this crisis. Let's say Odisha has also announced around 50 lakh compensation for the health professionals who actually will die during this COVID pandemic. In this case, social protection measures is very much more important to give those who are to save both lives as well as livelihoods in the country, as well as to give different kind of fiscal policy stimulus measures in the country, and various policies also measured in that, like supporting enterprises, employment income, stimulation of the economy through job, as well as the employment retention measures and protection of the workers in the informal sector, and using a social dialogue between the government, workers, and employers to find out the solution, those who has the need. And lastly, basically, we need to save both lives and livelihoods. That is one of the important priority in this given pandemic. Thank you, sir.
Okay. Professor Nayak and Professor Misra, maybe.
Yeah. Again, a very nice paper. I have only one observation, and I'll leave the rest to Professor Mishra following. My only observation is this: you've done some very nice work looking at the data from the beginning of the lockdown period coming up till the 31st of May. Now, if we would request you over the next 10 days to think, because after your submission of the paper, you now would have data, and I think 4 months have passed, June, July, August, and we are already well into September. At least for 3 months, certainly, there will be some extra data.
Yes.
Would you be able to integrate this new data within a 10-day period? Look at your study and your model, whatever model you have. Using that model, will you be able to look at, draw some conclusions regarding doubling, in how many days the cases are doubling, etc. Will there be any different conclusion, or would you be able to add to your analysis? So this is my observation. If you will be able to add another 3 to 4 months data, maybe your paper will be enriched further.
Thank you, sir. That will do the next. Thank you.
Professor Misra.
Yeah. Let me say that this paper was particularly shortlisted because we have to have one paper on the situation of COVID in general, because it's a COVID special issue. So the data explored here, as Professor Naik rightly puts, that it is little dated, and none of the analysis is basically to be presented in a volume which will come in a month or two with the dated data of COVID, because COVID data is cumulatively getting updated. And if you have your Excel sheets ready, perhaps you can make the entire analysis updated. That is one observation which Professor Naik made, is perfectly fine, and it is doable within the period of time that we offer you.
Yes.
And I have two small critical observations on the paper, which is important to make the paper sound better than what it is today. One of the things is that when you are talking about CFR and other computations and everything, what you should be able to tell is that please, in your reporting of the interstate performances and other things, you should be able to comment on the fact that actually there is a convergence towards the testing intensity that is on a rise. So the testing intensity on a rise. And one aspect that is perhaps people are now started, they have now started talking very recently, is that it is not the quantum of testing and the data and the number of positive cases coming, but also testing efficiency, because of the fact that per increase in test, are you getting number of cases? Because testing is, in case of COVID, is not a cheap affair, like, you know, you can do it at no cost, but there's a cost involved. So you should be able to indicate that which are the states perhaps where more testing efficiency is better. That means they must be locating periods. And you know, there are a lot of controversies around COVID data now going on social media, that you should avoid many of them which are not scientifically grounded. However, this is one thing which is scientifically grounded, because you can make the comparison. And the second observation that I want to make is that no one knows in this evolving pandemic that where is it going, how far it will go, and what will be the quantum cases. That's for sure. But in fact, one observation that should come out of your paper is that given the differential status of health infrastructure and health system efficiency across states, how has the pandemic responded in terms of the data and figures that we have? Because of the fact that many people are talking about Kerala did better, or, you know, Odisha did better, or they have, you know, there are states which are not doing well. Maharashtra still continues to be not doing well. Andhra is not doing well. What, I mean, we should be able to give some reflection on this regard. It's not necessary we are making an assessment or an evaluation of the states, but we should make some observation. Otherwise, my feeling is that the paper's necessary improvement is on updation. And second is that paper should have some implication component of your analysis, which is missing in the current form that you have submitted. And if you do that, even I will be pleased to go through it and say that it's done. Thank you very much. A well done paper, no problem.
Thank you.
Dr. Amarendra Das, you would like to say something?
Okay, just two comments. Can you, or have you done some analysis on the sex-wise fatality, gender-wise fatality, male, female, and different states? That is one. And the age group. So will this be possible for you to do
because
that?
Actually the major problem, thank you for Pulin sir, Mishra sir, and Amar bhai, like, for your valuable comments and suggestions. I like to update that thing. And coming to like Amar bhai, like regarding your thing, actually you don't have any particular data set regarding gender wise and age wise combination thing, and there is no public data set is available at all by the government of India, and only that database is available, that is the COVID-19 India.org, where they give all the information, like starting from the beginning till now. But the major problem is the data set, they give only few of the observations where they got the information regarding of that patient in terms of its age as well as in terms of its gender. So we don't have like the detailed information on that. You can make some kind of projection, some kind of that analysis possible, but exact information like how across genders or across age wise, what is the rate, it is very difficult to get that information. Only recent like studies also talks about, let's say, the fatality rate is much more higher, like among the elderly population as compared to the young and the child population. That is some kind of clues you can able to get, like the recent study of Subramaniam and William Joe. They discuss basically this particular fact by taking the gender and age-wise data. They say make some kind of projections, but exact getting the data is very difficult.
Let me clarify, Amarendra. Problem is that this paper uses the complete data set that is available to everybody. The gender assessment and all that is on a limited count. That is something like 13 to 20% of the total observation on which gender information is available. And we have done that paper that with Dr. Joe and all. So that that is a limitation of that work. However, if we want to do this, then actually they are not in equal parlance across states either. At a national level, it's fine. We still approximate, okay, 20% is available. And now there is more controversy surrounding that because there is selective data entry of this disaggregation of age and sex because of the facilities where the treatment has been done. So I think the entire data set that is used in this paper is non-controversial. So I would prefer that that is not done. Thank you.
May I make a small suggestion,
Yes.
please?
Yes, sir.
So I was just thinking, like in this interstate analysis, if you could think in terms of like bringing in the share of expenditure, state expenditure on health as a factor, and whether that has anything to do with the outcome. So that was one suggestion. And the other thing is, like, of course, you did mention about the testing efficiency issue. I was sort of wondering, like, whether you can sort of maybe have some kind of a more disaggregated COVID-centric sort of like health facilities and relating that to COVID-related deaths. If you can make a slightly additional effort, so we would know that, because I think the number of positive cases per se, probably that is not going to help very much unless you actually relate it to the deaths, and that may reflect in terms of whether there has been any provincial, state level special efforts, or whether the private sector has played a greater role. I think those are the sort of policy issues which I think if you can reflect on, maybe that's a good idea. And especially because scene has changed completely, let's say, since May and today. Even between states which did very badly sometime in May might be doing quite well today, actually. So that means there is some other input which you may broadly describe as policy inputs, whether it's the role of the civil society organizations or role of the private sector. I think some of that reflection might make it richer. So that was a small point I wanted. And we have just about 2-3 minutes. And if any of the participants want to make any comments, they are also welcome. But very, very brief. We have just 2 to 3 minutes. If anyone wants to say something on this paper.
One more point I would like to make, if you allow me.
Yeah.
I was just thinking, since Balakrishna handles a lot of different data sets, will it be possible to establish some association with, say, the migrant population, say, the density of the population in the states? Will that make some more meaningful analysis? Like, we may be able to interpret. Mr. Sir can tell, and then whether this will add value to the analysis.
Let's wait for any other comments, and maybe Dr. Padi can take a while to respond. Any comments from other participants? Very quickly, any particular otherwise, Dr. Padi, you can take about a minute.
Yeah. Thank you, Bhai, like for your observations. Actually, here I have also I'll try to analyze few of the things. Let's say, actually, I try to relate the level of migration, population density, as well as the level of urbanization to that of the COVID cases across states. That analysis I have already done. If it is needed, if you'll ask me like for your suggestions, then I can also include in my main text as well.
I think, Amarendra, this particular aspect that you raised, a detailed analysis of this has been published by Rudra in some blog somewhere. So I think Balakrishna knows it, and then he can refer it and make a citation of what observation was done on that analysis, especially in density and urbanization, particularly.
Yes. So, Professor Naik, Professor Misra, if you have anything.
And that's it. That's
Very
okay.
nice. Very nice.
Okay. Thank you, sir, for all your observations. I will try to note and I will revise it accordingly.
Please.
Thank you, Dr. Padi. We sort of move on to the next paper, which is in fact the first paper that we tried out. And if Dr. Josnamai Nanda, maybe you can try once more. Dr. Josnamai Nanda, please see if you can make the presentation now. Dr. Josnamay Nanda, please, or Professor Meher, whoever is willing. Professor Siblal Meher or Dr. Josnamay Nanda, whoever is ready. I had actually given a hint that if they could present the paper now.
She's asking if she's audible. Josnamay, you are not audible. If you start speaking something, we'll tell you.
Yeah.
Start saying something, please. Kichu kuhantu apano. We are not able to hear you.
Yeah, I think that looks like.
Shiblal Babu, apano kichu kuhantu. Apano be unmuted.
Okay, I just.
Since it is not audible, you can try after lunch. I have not prepared for this.
Okay.
Achha, you are not prepared. So Josnamay is supposed to do the presentation.
I just spoke to Dr. Nanda, and it seems that her device has some problem. The audio is not coming. She can listen to us, but she is not able to speak anything. So she is proposing that in the afternoon she will come to her office, and we can keep her presentation in the afternoon. Now some else can make the presentation before the lunch break.
Okay, that's fine. That's perfectly fine. So we move on to the other, like the fourth paper, which is in fact the third paper in terms of presentation now. P.C. Ranjan Swami and Vishwamohan Jena. The paper is on fiscal management challenges and COVID-19, a microview. Please, I think maybe Dr. Jena would present kindly. Yeah. Yes.
Is joined.
Okay.
It seems the transition is taking a little time. When we do the announcement, we can tell them the sequence of papers. After the paper of Dr. Jena, the next paper, his or her name should also be known so that they'll be prepared simply.
Okay, so in fact, the next paper is by Dr. Nilakant Panigrai and Rasmi Jaiswal. So that will be the next paper after Dr. Jena. Yeah.
Yes.
Because we have actually circulated the entire program to all of them, but I think because of the sequence, I think Dr. Nilakant Panigrai should be ready for the next presentation.
Yes.
And what about Dr. Jena, please? Is he ready?
Sir, our paper is on 12:30, sir. So this is the transfer of paper.
Sorry, I didn't quite get it.
Sir, our paper it is written is 12:30.
Because Dr. Jena, because paper number 1 could not be presented, we are asking. We are requesting you to present.
Was not presented. So there are some change in time.
So, are you ready to present your paper? If you are ready, kindly present your paper.
Sir, my colleague will be presenting the paper.
Okay.
I'm requesting you to join immediately.
Okay. Because we had requested all to join for the whole thing because there was a change in this program because the paper could not be presented.
Problem then Dr. Nilakanta Panigrai and Rashmi Jaiswal, I can see they are available. Maybe they can present.
Right.
I don't know.
I can present after.
I mean, this is all towards minimizing loss of time since we are.
Sir, namaskar. This is Panigrai from Bilaspur, sir.
Yeah, if you are prepared to present a few
It will
presentation,
be, sir, 10 to 15 minutes, sir. 10 to 15 minutes we need, sir.
yeah, perfect. I think the chairperson is Professor Keshav Das. He will advise you. Yes.
Professor Das, we need 10 to 15 minutes, sir. We don't have current supply now, but through mobile we can do it after 10 to 15 minutes.
Okay. I think maybe if
After this, sir, after this.
is willing, maybe you can.
Sure, sure.
Yes, sir.
Yeah.
I can join.
Okay.
I would request trying to start. Fine.
Yes.
Yeah. Please. I think Dr. Kirti Swai, he has to unmute and you can start the presentation. Yeah.
Sir, very good morning, all of you.
Yeah.
Sir, I would request my colleague Professor to present our.
Vishwaran sir, your voice is break. Your voice is break. It's not clearly audible.
Presentation.
Hello.
It's ready. You can start presentation.
Can you start the presentation, sir?
Yes, sir. Yes.
Okay, sir. Sir, very good morning. Myself, Dr. Kirtiranjan Swai, one of the faculty member in Indian Institute of Production member, and my colleague Dr. Vishwamohan Jena, our and respected guest present in this seminar. So our paper basically related to related with financial management challenges and COVID-19, a macro view. I'll go for the share my presentation. The paper is financial management challenges and COVID-19, a micro view, and this is the outline of our paper. The paper is covering the introduction, literature review, research objectives, research methodology, financial management and COVID, a brief discussion. Then what are the challenges? That means financial management challenges and COVID-19. What are the strategy to measure or to overcome the challenges, and conclusion. First, I would clear that this is a theoretical paper. It is not the based upon any quantitative. We study the different journals, different government magazines to study the financial management and also the COVID situation. So accordingly, these different papers and different magazines, different government sites, then we prepare this paper. So as per the introduction, as we know that after the Second World War, almost every country has been affected during this COVID-19. Since last February this year, India started witnessing the COVID-19 case, and due to this pandemic and driven crisis, India facing predicament of all the sectors, also in the financial fluttering. Then the coronavirus ravaged the economic foundation of the world trade, and the world is also going to face economic crisis. So some of the literature also related in this. One is 2020 in their research paper highlight about the Chinese universities, how significantly commitment to the crisis change administration. Gosling in 2020 also highlight the changing face by the world due to the novel coronavirus. The coronavirus has a well-being infection impact around the world, yet it has brought financial virus to every financial virus to whereby speculator worldwide have gotten carefully about putting their assets in the offers and putting their assets in offers and bonds. India saw a trip of capital of network scale and proactive with the regard to the countering the monetary impact of COVID-19. Fiscal management involved overseeing and monitoring capital expenditure as a result of general more revenue, which leads to smooth functioning of the operational activity. Vishwa sir, it is clearly audible? Hello? Hello?
Yes, you are audible.
Yes.
Sir. Then basically the paper discuss regarding the fiscal management system and challenges faced during this pandemic, and also the highlight the strategic policy adopted by the government of India, how to overcome these challenges during this pandemic. Some of the literature review also discuss related this paper. One is I've cited over cited some of the literature related to this financial fiscal management related with this our paper. The change highlighted that corona has changes affected each and every one personally and professionally. So investigation is needed to make the industries and farm sustainable and being a new world after COVID-19. Likewise, Parodi and Lewis 2020 discussed the way and means of protecting people from other infections. And same, if you go further, same Bhanumurthy 2020 highlight the global economy is going to have a setback and may go on the deep depression, and also suggest suitable policies and precautions, a preventive measure for making the economic prosperous at the quick time due to COVID-19. So these are some of the literature which is related to our paper, and we present over here. Then our research objectives: to discuss the financial management challenges faced by the India during present pandemic, and also to discuss the strategic policy taken by the government of India to overcome the challenges. So this is the two objectives of our research paper. Then the research methodology, basically it is a theoretical paper. So we for this to fulfill our objective, we study the or we review some of the books, research paper, articles, government guidelines, internet, to follow and to find out the some of the information and to fulfill our objectives, and analyzing, interpreting, and critically evaluating the literature to fulfill our objectives and to satisfy our the objectives. And then some of the discussion related to the financial management, that means fiscal management related to the COVID-19. As we know that the economic has been badly affected due to the COVID-19. A proper financial management system, fiscal management system is necessary for the maintain the health of the economy in systematic and effective manner. After post-COVID-19, there will be slow in economy and inflation will grow fast, very fast. Managing the poor fiscal policy is the need of the hour. It may contribute to revenue deficit, adversely affecting the growth of the government. So some budgetary administration framework and foundation will will in general become a focal point in the endeavor to think a rapid and productive open segment reaction and event in the bottleneck, so that the budgetary administration measure the incorporate brought together, organized and progressively straightforward government obtained strategy, including investigation of the key merchandise and venture gradually gracefully change. So fiscal management challenges. What are the basically challenges faced during this COVID-19 related in the fiscal management? So as per the IMF 2020, the COVID-19 pandemic has made negative economic per capita. The pandemic has turned economic crisis which affect economic and national security also. Fiscal policy has played an important role in India, especially with regard to monetary policy, and helps to run the business smoothly. So these are the challenges basically faced by the government during this pandemic. First is tax and expenditure profile of India, fiscal deficit issue in India, expenditure reform, advanced economic challenges, emerging market challenges. So these are the basic challenges faced during this COVID period by the government. So question is that how to overcome these challenges. Now these are the major steps we have to follow to overcome these challenges. One is inheritance taxes, financial stimulants, long-term capital gain, foreign portfolio investment, then FPI, then category 3 alternative investment fund taxation, improving transparency of the public expenditure, avoiding unsustainable infrastructure asset, conventional measures. So these are the measures, or these are the strategies we have to take into consideration to overcome the challenges which is faced during this COVID-19. So all the discussion in our research paper related in the challenges and related in the strategy. Then lastly, we could go for the conclusion of this in our paper. In general, COVID-19 has carried unfold hopelessness in an onerous segmentation in the low pay people over the globe. The micro, small and medium enterprise, particularly in our serious building products, fabrication giving the extraordinary possibility to business and development of the economy. The more the move within the arrangement worldview is required to put the nation state within the center arrange to play a basic part of the reshape the economy and keep it on the way of economical improvement, whereas ensuring the life and characterized environment. The need of the great importance is to develop new and intensive component to defect the financial difficulties brought about by the pandemic, and occasionally check out to design the future resources of the financial development in the country. And lastly, the export segment should be given more scope than the other segment. So this is the conclusion of our paper. Thanks.
Thank you. Thank you, Dr. Swami, for completing on time. So may I request Professor Nayak and Professor Misra to share their views. Yeah.
Sir.
Professor Nayak.
Yes, I'm unmuted. Thank you, Professor Das, for asking me to give my comments. Well, Dr. Swai and Dr. Jena, you are addressing a very important issue. That's the first thing. You are looking at fiscal management challenges and COVID-19. This is a very important issue, but my observations will be mainly two. You know, there's been a huge amount of discussion in the last 5 to 6 months regarding what fiscal policy may be expected to do in a situation like this which has emerged. And in the Indian context, we can see that in the very first quarter, GDP drop has been as much as 23.9% or 24%, a very sharp drop. In a situation like this, what are the things that are really needed? I think your paper probably falls short of really spelling out the really major macro dimensions of the problem. Number one, do we need a major Keynesian fiscal stimulus that should be given to the economy? The finance minister announced that something like a 10% of GDP is going to be earmarked for pumping in. That's the government expenditure into the economy. But many experts feel that that amount has not actually been given. What has been given is barely about 1.5% of GDP, and that is not sufficient. If we do an international comparison, countries like the US, many of the major West European countries, they are giving upwards of 10% of GDP. Actually, even in a fairly right-wing setting in the US, President Trump has also been forced to give a very large fraction, almost 10% of US GDP has been pumped back into the economy because the unemployment has suddenly increased in the post-COVID phase in that country. So likewise, in the Indian context, what is the extent of demand push, Keynesian demand push we need to put? There has been a supply problem also in the Indian context. When you have this kind of a severe lockdown, many industries were totally shut down. As we all know, the transport sector totally shut down. No trains were running, no planes, no buses, etc. Other major sectors like restaurants, hotel industry, and so many other industries, they were under total shutdown. So how do we revive the supply channels? That is another issue. So when you're looking at fiscal management, I think this point needs to be looked at. That's point number one, very broad point. Point number two, you know, in the Indian context, again, when we are doing fiscal management, you look at the center and the states. We have a federal setting. States today, like Odisha, almost state Odisha, the states are supposed to spend money on education, health, so forth and so on. And right now, we are confronted with this health challenge. Government is short of funds. All state governments are short of funds because the center has not been sort of paying the promised amount on the GST sums that have been collected, so that there is a big payout that the center needs to do to the states on the basis of the GST payments, but the center is not doing it. It's a political problem. So this is also a fiscal issue right now. States which are supposed to be spending money in terms of the fiscal amounts to address the pandemic, states are falling short of funds. So this is a fiscal issue. I think there's been no mention of the federal fiscal aspect. I think there should be some mention of this because I feel that this is an important part of the fiscal issue that needs also to be addressed. I don't know how you will do it, but these are my suggestions, 2 suggestions.
Yeah. Professor Misra, if you...
Yeah, first let me tell that this particular paper was considered in the shortlisted group because of the potential issue that it is addressing. That's about fiscal management. When I read the paper, my observation on the paper are that it is merely a kind of a very descriptive paper. It talks about things like for instance, you can talk about or you yourself told that you borrowed from literature and you told that these are the fiscal management strategies that is adopted and this will be the consequences and all. But, for myself, I feel that, a research paper of this kind needs to have some kind of quoting of, even if you are not doing yourself, people have made computations on the basis of the strategies that government pumped in money. There are, you told you have borrowed from literature. People have actually worked out that if this much money is pumped into the market, this will be the demand generation. These are the sectors in which there will be signs of what they say green shoots or whatever growth might come. So even if you are not doing your own computation, I would request that you please quote few of those quantitative values and figures that exist in the literature, not merely stating words that these are the strategies which are there in place. And second and most important part is that when you talk about whether these measures adopted by the government, as Professor Naik rightly told, that there is a federal part which you are completely ignoring between the states, and states are more in distress than what the center claims to be, that we have done. And in fact, there is a lot of news you must be reading about the GST collections and its share and all that, which is also affecting the states to manage their own finances. However, I feel that that part is a very, very essential part when you talk about fiscal management of a crisis like COVID. And besides, I would say that when you talk about remedial measures, yes, remedial measures, you are not proposing anything. You are actually telling which are theoretically placed and government has adopted with the wisdom of many experts and all. And time have elapsed from the day that these fiscal measures have been adopted by the government, and how much of it has shown some kind of, for instance, the most recent PLFS data talks about what is happening to employment. And if you say that if this money or this kind of stimulus is put, what will be the kind of a projected employment or recovery in these sectors could happen, what people are predicting. So I think if you borrow upon some of the most genuine work which is already in the circle of the literature, your paper can borrow on. I'm not saying within a short while that we give you can make a new computation or you can make an assessment of your own, but because you are interested in describing the fiscal management situation, you should not be discouraged to do so. At the same time, we feel that we must also have some kind of, a reader must get some impression that the figures that you are quoting are scientifically done, and these are the implications that is available. Because in words, I can say theoretically that this happens, but then automatic question comes, how much? So I think that part, if you add up and then make it a little bit comprehensive, then obviously it will stand its own ground, saying that you have a article on COVID and fiscal management crisis. However, I feel that my own saying on this article, I think within the short period of time that we will offer you to revise, you have to add some kind of evidence that exists already in literature in relation to the topic that you are claiming. Second, the failures and success of the remedial measures that people are opining on, you should also be very much positive to state that in your paper. That is all can improve the paper to a little better level. Thank you very much.
Thank you, sir.
Anything, Amarendra, if you...
Okay. Since this report, this paper is on the fiscal management, I don't know whether the authors have looked at the report that is published by Odisha Economic Association. Because in the association report itself, we had a special chapter on the fiscal management, and we have calculated like what will be the quantum of deficit, and I think that would be probably near to the reality. Actually, the projection that we have done. In fact, our former finance secretary and former chief secretary, Mr. Jugal Mahapatra, had also reviewed that, and then he had said that this forecast is near to like the reality. And so I think the authors have not looked at that. And then so far as public finance is concerned, there's a lot of data available in the public domain. And in fact, we have the data till the month of August. So the authors should have ideally looked at the data, and then they could have done much more meaningful.
I was exactly hinting at that. They should borrow from these existing documents and
Yes,
improve.
Yes.
definitely.
Yeah. Maybe I have just a small point. I mean,
But some time we will definitely incorporate.
yeah. The one small point is like I was wondering, in the title you have a word called micro view. So what is that micro view?
Yes.
Sort of sounds you are sort of like, as Professor Mishra suggested, are you saying something about employment, for instance, or certain subsectors? So what is that micro view in the paper? I thought that I didn't get. But any other comments from the audience, like participants, if they want to ask maybe one or two questions very quickly? I'm requesting any participant they have anything to comment or suggest. If no, so maybe we just listen to Dr. Swami for about a minute or so, if how he wants to respond, he and his colleague would like to respond to this question.
Okay. Sir, definitely we will go for the revise the paper as per the suggestion from the Professor Naik sir and also the Professor Mishra sir. So we could go for the add in our paper in the certain federal issue and also certain quantitative data include in our paper. And as per the Samarendra Das sir advice, some of the data is also available. So accordingly, in very short period, we will try our level best to include all the comments given by the expert. So to make our paper is strong for the journals. I think it is good for us to get some positive feedback related and to modify some of the which is not in our paper as per the Naik sir and as per the Mr. sir and as per the also Das sir. So we will go for the definitely revise this paper and try to submit within the stipulated time period, sir.
Very good. Very good.
Anything else,
Thank you.
Dr. Naik,
Thank
Dr.
you, sir.
Mishra?
No, that is all. I think if you would be able to do that, that would be very nice, because Dr. Swai and Dr. Jena, the reason we are saying all this is because the title of your paper is very promising. You are talking about fiscal management challenges.
Fiscal.
So because the title
Right,
itself is very promising, the reader will look for some material which meets that particular title. And in order to do justice to that title, I think you should follow these advice that we have given. Otherwise, your paper should be, with all these changes, it will become a very promising paper, I think. So all the very
Sir, definitely, sir.
all the very best to you.
Sir, definitely I will take your suggestion and I will try our level best to modify of this paper.
Thank you, Dr.
sir.
Swami and Dr. Jana. So we move
Thank
on
you, sir.
to the next paper by Dr. Nilakant Panigrai and Dr. Rasmi Jaiswal, if it is possible. Dr. Panigrai, are you sort of, is it possible for you to present now? Dr. Panigrai?
Yeah, he's presenting. He's presenting.
Okay, please.
He's presenting. Great. Very good.
So his paper is on impact of COVID-19 on the day-to-day life and living of people, an empirical study in Chhattisgarh. Please, Doctor.
Uh, Sir, I am audible?
Yes.
Yeah, yeah.
Yes.
Yes, you're audible.
Sir,
Yes.
Professor Keshav ji, coordinator of this program, Professor Tulin Naik sir ji, and Professor Uday sir ji, who are all esteemed member of this editorial board of this one of the oldest journal of social science in general and economics in particular of India. So I am present here with my co-author colleague, Dr. Rashmi. चला गया मैडम, चला जाता है, हाँ, अच्छा. Dr. Rashmi Jaiswal and other members present in this webinar, Economist of Odisha and India. So this is a presentation by two anthropologists who normally believe on the ground realities, what is happening with the people and the state impact. So impact of COVID-19. COVID-19 on the day-to-day life and living of people, an empirical study in Chhattisgarh, one of the central part of centrally located states of India and newly formed state. The presentation will be like this. The introduction, theoretical framework, COVID-19 little, then study objectives, research methodology, Chhattisgarh this study universe, then respondents profile, then study findings in relation to the major highlight. We will talk about the awareness of the concept of COVID, then attitude of the people respondents, then changes in health hygiene practices, then conclusion. So such pandemic situations or the chronic disease situations is not new to the present time. It has been a part of the human history. So the nature of these epidemics varied widely and influenced by geography, disease movement, novelty, severity, population immunity, nature of infectiousness and contagiousness. Similarly, from the local perspective, people perspective, this also, the response of people also varied because of the various factors like human behavior patterns are the product of their culture which are built over generations and differ according to time and space factors. So in many such cases, this state plays a very important role. Definitely, we agree to that. But by and large, the states many times fails to achieve the targets as desired by the state. It is basically a state ignores the cultural aspect of the people, the social aspect of the people, the practice, the all the aspects of the people. So with this little background, our paper based on empirical study aiming at to assess the current level of awareness of the people, to identify the current level of knowledge of the people on various preventive measures popularized by the state on COVID, then to document the major socio-cultural barriers in the adoption of key behavior pattern to counter the COVID, and to document the changes with respect to the health and hygiene practices as popularized by the state, and to what extent this has been adopted as a part of their life. So coming to the ground, let's look at looking at as an anthropologist, we look universal by nature, and with the ecological culture and social, which is done as a survival. So medical anthropology and this is a social perspective in this ecology. So various issues like aspects, cultural aspects, social, political, ecological, and medical dimensions. Aligned in the adaptation aspect of any disease, which not only brings physical changes to also socio-psycho-cultural changes of individuals and the groups, while the cultural interactive theory gives a local context, local meaning to the disease. Klinman popularly is also known as the meaning center. Cultural interactive theory means in the context of the community and the culture it is to be interpreted. The critical medical anthropology, latest theory in medical anthropology to deal with the disease and treatment by Bayer and Singer. They emphasize a very broad aspects of epidemic or pandemic management. They emphasize the cultural construction of disease, structure of power and inequality, and the social origin of disease. Therefore, the threats posed by the infectious diseases today are being amplified by social, behavior, environmental, and policy factors that has attracted us to adopt this. As you know, COVID is it is also pandemic by nature because it fulfills all the characteristics of pandemic. And it has also gone to any country. 213 nations of EU have been affected by this. And globally, it is a global epidemic and pandemic. The International Organization WHO has declared. And it is also pandemic by nature because it has the characteristics of wide geographic coverage. It has a novelty, it has a severity, it has a high attack rates, and it has contagiousness. And it is special to Indian context because we have to see, because India is a different country in this sense. Large population are engaged in informal sector and also in agriculture, and a large population living in the rural area. That is more important, has to be taken into account. So if you come to Chhattisgarh situation, Chhattisgarh is a newly formed state. Before coming to the Chhattisgarh situation, let me tell that a review of literature we have gone through, the latest relating to the COVID-19 situation, couple of reviews we have made, and also historical we have seen how in 19th, 20th and 21st century, pandemic diseases or chronic diseases or infectious diseases have attacked human society and human population across the world. So coming to the methodological aspect, purposely to say, we did this work with the help of our students because it was not planned initially. Because of the COVID situation, we had to plan accordingly. And with the certain areas, urban area and also in the rural area, along with the students. So we adopted a purposive random sampling. And the samples we are collecting on a basis because there's a lot of restriction from people's side, state side, and our apprehension side also to assess the awareness, attitude, and practice, which is known as the briefly we said it's up, A down, up. So we three rural villages and it is a railway central point, Korwa district, Jangiri Champa, another district which is the industrially rising district, and all are adjacent to each other. That is the districts of Chhattisgarh. So we collect interviews. We are also present in some of the interviews, and with both closed and open-ended questions incorporated in the schedule. And we followed the state guidelines since we are dealing with the students who are also involved in the process. Both quantitative, qualitative data we present quality. We of the study findings. So the scope of the study was limited to a short duration because of the pandemic pressure on us by the community, by the police, state personnel also. So we believe that couple of findings are there in the paper. It will help to the researchers. It will give a ground reality situation in tribal dominated states of India, and it will help us and also others. Coming to the profile of the Chhattisgarh, we see around ST population, around 30% ST population, SC population 12, around 50% population are belonging to scheduled communities, which is a very special feature of our state because that determines a lot. If you look to the literacy dimension, because these are the indicators which influences many aspects. Literacy also, average literacy is 70%. Sex ratio is much better than any other state. So coming to few other indicators, sex ratio, in terms of sex ratio, child ratio, then child literacy situation, the state is not at par with many developed states. So if you look to the background I am telling, then we will go to the ground reality. In terms of migrant situation, the Chief Labour Commissioner of Government of India admits, and given the data also, that this is the highest and this is the state which has provided the highest migrants. 26 migrant laborers, 10.85 lakhs of laborers migrated to outside, which is followed by Kerala, Maharashtra, and Tamil Nadu. So coming to the socio-economic demographic of our study population, as I told that we have selected 160 number of respondents from both rural, equally from both rural and urban. We fixed our respondents that 25 or above age was the bar to select, and then literacy wise in rural area, the people are little behind than the compared to the urban area. Occupation wise, agriculture is the dominant one in rural area, then wage labor, then government employment in private and government sector is the dominant one in urban area. House type, kacha, rural area, kacha house type is dominant one. BPL, APL, around 70% in rural area are BPL, and 31% in urban area are BPL. Supply of electricity, almost 100% have the supply of electricity. Coming to the land status of the household, homestead land, on enclosed land, around 13% are living, and 62% rural area have the patta land. Coming to the awareness indicators, I will highlight 2-3 indicators. We wanted to know to what extent the people respondents are aware of the major so-called scientific symptoms of COVID-19. We see on an average responses were in case of fever, cough, and shortness of breathing. That was the average response in rural area. But coming to the urban area, since urban area people they vary in educational background, they vary in couple of indicators, so the response was comparatively high. If you look to the two other throat pain, sneezing, these are the two features of COVID was responded very poorly in rural area, because the poor awareness program. If I'm going little beyond the awareness program, as I had compared with the Odisha situation, I was going through the media news also. So the awareness program made in Chhattisgarh is comparatively less and low. So access to visual media in rural Chhattisgarh is not also that high. That has influenced a lot in terms of having a high awareness of the rural respondents. Coming to level of knowledge of the respondents on various preventive measures popularized by the state to curb COVID-19, we have taken certain indicators. Social distance, all these are the popularized by the state. Social distance, staying at home, avoiding public gatherings, frequency of hand wash, use of mask, use of sanitizer, no response. We see quite satisfactory in case of staying at home, avoiding public gatherings in rural area, because this is the nature of living in the rural area. This is nothing new. Because of the COVID, they are not staying inside the house, or because of COVID, they are not going for public gathering. The rural nature of life and lifestyle is like this. So you coming to all these indicators in urban area, the responses are quite high. Average in urban area, but in rural area, people are a social distance, avoid at home, do the agriculture work, do the life and livelihood work, then stay at home and use scarf during the work whenever they go outside. The use of traditional scarf, even in urban area, I have marked in Chhattisgarh, it is very popular. When the student of campus of the professors used to use scarf in summer season. Later I know what is the reason. So coming to the major cultural in the key behavior pattern, the attitude part. Attitude of study population, rural Chhattisgarh I am talking, Chhattisgarh in general I am talking. It is not Andhra Pradesh, or it is not Gujarat or Maharashtra. is influenced by the social ecology. But the type of ecological setup here and the type of socialization process is here comparatively.
Dr. Pangre, you have just about 2 minutes.
Sir.
Yeah, thank you.
Sir. 2 minutes. In initial days, people in rural area, due to the limited world knowledge, neither understood nor took account of the message of COVID-19. When the laborer from outside came into Chhattisgarh, then only it became a discussion of the point, and they became little concerned about it. Rural people, the government was, if you look to the preparedness of the government, the preparedness and the part of the government was inadequate. If you look, 2 indicators I am telling, government only recently thinking of linking to the private hospital now in Chhattisgarh, which was a beginning part, in Orissa. One, the first phase of initial lockdown did not have any impact but the rural people had nothing to do with the government decision or lockdown. Then second phase of lockdown, when the laborer came, then only it was a little issue. And the people do not want to continue this lockdown process because it is related to their life and negative affects their livelihood. And people could not compromise in their day-to-day routine life. Restrictions imposed by the in festivity that happen in throughout India. All form of restrictions were imposed on the festival and festivities. The rural region, the people consider that their lifestyle by and large is naturally based on maintaining social distance and isolation. Coming to the conclusion aspect I am coming. And the third part, changes observed with respect to their health and hygiene. We have adopted the hand cleaning, use of mask and frequency of hand cleaning, then type of mask, then all the indicators we have quantified, we have collected and quantified. Coming to the conclusion part, awareness, attitude of practice in the current and the impact of the empirical data collected only this COVID-19 based on empirical data collected from rural urban region. Medical science and medical scientists consider development as the only to 1 minute, sir, as the diffusion of scientific knowledge and their adoption in behavior. They believe that it should be adopted by the scientific knowledge. Administrator look development as adoption of new behaviors like capsules. As if through all the police actions, bureaucratic action, it will be adopted by the people. But the social scientists, by and large, look the impact of development on the society. While anthropologists, we look at communities as the organized group of people who have history behind it. They learn to live and work together in a pattern arrangement relation for their common goals. For them, culture contributes in making pattern behavior, which is very important of a society and impacts on the role of behavior. In principle, the strategies adopted by the state to curb the spread of coronavirus address to both medical as well as behavioral aspect of the disease. In practice, the strategies adopted by state aims to change the awareness, attitude and practices of the people by way of implementing various strategies like lockdown, shutdown, use mask, popularizing limited movement, motivating people to confine at home, closing down religious cultural centers, restricting gatherings made due to the public meetings, bringing back to the migrants like this. At the end, so in order to control the spread of corona, the state adopted all the strategies within the short period, started from the March 20th to in a repetitive manner, and expected that the people in mass will be aware of this attitude. Little variations, whatever are observed, have been quantified, doesn't show the sustainability of this new adoption. Firstly, to bring change in the behavior pattern, transfer of scientific knowledge should be a part of educational syllabus from the school level to the level, targeting the childhood learning. Secondly, strategies adopted to address the needs of the mass should integrate the grassroots communities, including the Panchayat Raj institutions and urban bodies as a part of the long-term vision. It should not be a government-sponsored program, in bureaucrat program, police department program. So from the very beginning, it should be a part of the community-based approach. Thirdly and finally, it must be accepted that any change in the behavior pattern are the product of cultural needs, demands a systematic and long-term intervention. With these references we have given, it is in mentioned. So with this, within a short period, it is not possible to present the entirety. So all types of suggestions, comments, and feedback we welcome, and we are noting it down for further modification.
Okay.
Sir, thank you, sir.
Yeah, thank you, Dr. Panigrahi. We sort of we would listen to Professor Naik's comment, Professor Misra's comment, and others. Professor Naik, sir.
Yes. So, Dr. Panigrahi, this is a very important issue you are looking at. I applaud your effort in this area. And let me begin by saying that you are also looking at the problem not just in a purely narrow economistic kind of framework, but you are expanding it to the cultural, sociological, anthropological aspects, which is very important, and in particular very important in a state like Chhattisgarh. So I think that is a very important part of your analysis. The second thing I would say is that this is also a state which has which is responsible for a lot of the migrant laborers who have gone out of the state to some of the other states like Gujarat, maybe some of the southern states, maybe some of the northern states, and so forth. How precisely have the lives of these migrant laborers been affected? Because you are looking at how the day-to-day lives of these individuals have been affected. So a keen look at these individuals would be desirable, I feel. Your study would have been completed in the first 1 or 2 months of the lockdown, but now again you have possibly 3 months more data and some kind of maybe some of your students have gone out and spoken to some of these people, those very families to which they went. Maybe these things can be culled out to get some additional information as to how have some of those migrant laborers who were in Gujarat, Rajasthan, Delhi, and Karnataka, let's say Bangalore, etc., have they returned back? After returning, what is their situation? And that will give us a better idea of what is happening to the day-to-day lives. Now I come to the individuals who are not migrants from, and a large section will be remaining within their village and within their sort of community within the state. What has happened to their lives? Quite clearly, we know that there have been job losses across the board. You know, sitting here in Delhi, I know that people who are carpenters, who are dhobis and washer people, and so on, they have lost their livelihood over a longish span now, 4 to 5 months. What has happened to these individuals? In addition to the loss of livelihood, what has happened to their incomes? Many individuals say that they have no money in their hands right now. So if you're doing a sort of survey based, I welcome the fact that we are having some study which is survey based. You are asking direct questions and you are getting quantitative answers. Maybe we can enrich ourselves by checking to what extent, if possible, to what extent their incomes have dropped and what is the exact nature of their hardship. And so I conclude by saying that it's a very nice study. Move ahead. If you have got some additional information, both quantitative as well as qualitative, that would be very good, and it will throw further light and strengthen your paper. Thank you.
Sure.
Okay. Maybe we listen to Professor Misra.
Yeah. Let me say that this paper is slightly different from the series of papers that I read because of the fact that this is based on an empirical inquiry on the ground. Even if that's the virtue of this paper, I would try to highlight some of my critical observations, because often you can do a micro field survey, it is fine, but to meet the scientific requirement of a particular output, I would urge for you to do 2 to 3 things in this paper. First of all, you are doing this in Chhattisgarh and the background districts and the locations from where this survey has been conducted. You could provide a kind of a background profile of those regions, because that's very important. You could say that 200 household survey represents Chhattisgarh. I'm not talking of representing in the sense of statistical sense, but however, the regions that you have gone and done the survey, those regions have some background information, whether in terms of their geographical descriptives, population descriptives, or something of that kind. And that would perhaps be better to provide it in the paper itself. Secondly, I felt that even if it's a quick survey of 200 sample size, it is not to say that it is a limited or a small sample size. It is a variation. You have given some kind of a background characteristics table in the paper. If you have given that background characteristics table in the paper, it would be desirable that that background characteristics information that you have has to be related to the perception information that you have. What you have done is independent perception information has been discussed and background information is given as like your sample profile. So you should be able to connect it because you will be able to make some inferences regarding whether young people are perceiving it better or old people. Is it among the people who are in different occupations? Is it of the people? Because you have some broad characteristics and linking them will give us some kind of an inference, which is very important, that these interventions are put in from the top, whether these interventions are acceptable and these interventions have an effect or not, how much people agree to do this and don't agree to do this. That's a very interesting part of such an inquiry. And finally, I feel that you have sample respondents information, secondary information about the household. Because often what happens, you must be reading in the literature, there are 2-3 axes of inquiry which people are doing with relation to COVID interventions. For instance, what is happening to gender? How are women taking it? How are women affected? For instance, people are talking about how has it affected the psychological and mental status of children being arrested at home. They are not conforming to it. What difficulty do they face in terms of making children conform? So when you have an inquiry of this kind, these aspects must be with you other than being quantitatively collected, other than in terms of your qualitative or what impressive impression that you shared with us. So my pointed comments on this paper to improve: A, you provide a background information of your location where you have done the survey. Second, you also try to highlight a connection between the characteristics that you have of the surveyed population with the outcomes. And then third, you must be able to say some qualitative aspects of observation that is obtainable from the axis of what women say, how householders manage children conforming to these norms, because it is in a tribal community. You can't go and tell them put masks and roam around. They say, who the hell you are? I mean, we don't believe in COVID. So we need to know this directly imposed restrictions, which are quite urban compliance driven. We should know that what happens to it in a tribal community. And you get your comments, and if you do improve this paper in terms of content, we would be very appreciative of it, because it's a primary inquiry, and a primary inquiry in a place like Chhattisgarh bears significance in a COVID special issue that we have. Thank you very much.
Professor Das, I just want to say at this point, I fully agree and concur with what Professor Mishra said. The implication of COVID on the gender aspect is very important, and a lot of studies are coming out how the women have had to cope with the difficult phase that families are going through, and because of the difficult phase, a lot of the pressure again comes on the women, and also what it is doing to the children and their sort of how they're spending their time. They're not going to school. Is everything okay? If you're sitting in the houses, I don't know how many of the houses in Chhattisgarh would be in a position to have those so-called online lessons with the schools and so forth. So these are ways in which we can see how the day-to-day lives have actually been altered. So I thought this was a very good point that Professor Mishra.
Amarendra, if you want to say something.
No, sir, I have no comments.
Okay. I was just thinking, maybe I think some of the very interesting points made by both Professor Nayak and Professor Mishra. I was thinking like any reference to capture the change. By that I mean that like if we have some sense of pre-COVID and post-COVID situation in terms of, let's say, access to certain kinds of basic services, whether there has been any change or it is actually in the background of unchanging state policies towards, let's say, certain social sector component. We are talking of a change where we have made very little investments, or as you very clearly stated about that, very little thing has been done in terms of creating awareness, for instance, or a very little effort has been made in terms of, like, particularly if you are talking about online education system, whether some kind of a role of the state, if you could kindly include in this, that may be. Otherwise, it remains a very micro study, and even if you know the behavior, which may have slightly changed, but I think if you know a little bit about the state's proactive role, and that might give us a sense also about the difference between the rural and the urban, which is actually basically your sample 160, I think you said. So if you have taken from both the sides, so we may know that whether the urban Chhattisgarh has done relatively better or worse compared to the rural Chhattisgarh. So I thought bringing in the state to an extent might have solved it. And before we end, maybe just we have 2 more minutes. If any other participant wants to make any quick point, which may be of help to both Dr. Panigrahi and Dr. Jaiswal, maybe 1 or 2 questions if anyone wants to ask from the audience. I think partly because I think both the audio and video were not probably clear. I don't know that was an issue. But if there are any questions, please ask right now. Otherwise, Dr. Panigrahi, you might take just about a minute and tell us what you might.
Sir,
yeah.
Sir, I have noted down by Professor Naik, Professor Mishra ji, and by you also. All these points I have noted down, and all are quite important to enrich the paper, because since it is an opportunity to collect data and empirical base. So these are the dimensions has to be highlighted. We'll try our best, because Bilaspur town and adjacent villages, I can personally visit the households, and the distant districts will link with our students. But we'll collect all these data in relation to all these dimensions highlighted by the esteemed editorial board.
Excellent, excellent, very
Sir.
good. Excellent.
So, definitely we'll collect, sir.
Very good. Yeah.
Sir.
But the time is very limited. You only have, I think, 10 days or so to complete the entire work. You'll be able to do it. You are being given very limited time.
Yeah.
Sir.
So I think with this, we have just completed exactly on my computer. It shows 1 p.m. and we have a break of 1 hour, and at 2 we come back, and the speaker, as I've already sort of suggested through the chat, Dr. Ashok Gupta and Dr. Sudhakar Patra will go for their paper at 2 o'clock. And I also make a request to both Timlal Meher and Dr. Nanda to be ready for the last presentation this evening. Thank you so much.
Thank
so
you.
We get back to 2 o'clock.
Okay, thank you.